Today's video is a follow-up on the previous one. This one is about fixing the US healthcare system. Why do we have to fix healthcare? For one simple reason: because of the runaway costs. Right now, legislation is being drafted in the United States Congress, followed by debates and eventual passage, possible by year-end. Fixing healthcare involves a grand compromise between all the interest groups, because there are different segments of the population which are for or against healthcare reform one way or another. Let me give you the ideas that are to be incorporated into the legislation. First one is about single-payer system. Single-payer system means the government takes over everything. The government takes over the healthcare, especially health insurance. Now you know that in the US, which is not a communist country, people tend to argue whether it is better or worse for the government to take over as far as quality and cost reduction, which is very important. Is it better or worse? Besides the doubt, we're also sure that there will be fierce opposition from many groups because they don't want government interference, especially the insurance company, because they are afraid that when the government takes over, they will drive them out of business. So that idea may not work. The other idea is a public insurance company. The government establishes a public insurance company which is used to compete with the private insurance companies. In this case, when there is more competition, the costs will be lowered. So this is the objective, to lower costs by injecting more competition into the insurance industry. Universal coverage. As I mentioned before, there were about 57 million people without medical insurance in the US. So universal coverage means that the government will try to do something to help to insure those people. What does the government do? The government either insures them or subsidizes them to get medical insurance. In the insurance industry, the fact we know is that the larger the market, the less the cost. If we have universal coverage, that means we create the largest market. In that case, we can get the cost down much further. When we talk about universal coverage, do we cover everything or do we just have a bottom line? We should have a bottom line if the government wants to save cost. The government only provides a basic safety net for all citizens. That is, the government insures them for catastrophic insurance. Catastrophic insurance means those that don't occur every day, such as cancer, incapacity, and many others. And in addition, because there are a lot of private insurance out there, people who can afford it can buy additional health insurance besides what the government provides. The government only provides a basic safety net. Now we come to another factor of how to reduce cost. Free flow of information. This is also important if we want to get the cost down. So all the hospitals, doctors, and insurance companies, they are required to publish their prices and their kind of service and the quality they provide on the internet. In that case, the public can compare and choose the lowest price. Another idea to reduce costs is to reduce waste first. The healthcare industry in the US is costing over $1 trillion a year. When the market is so big, you can easily cut wastes by becoming more efficient in your operation. And if you do that, you can easily save billions out of $1 trillion market. One method is to digitalize all the patient's records in a computer and put them in a safe, secure database so that any doctor in the country can see it. This is much better than the current system, which relies on a lot of paper records. We have to do something about the insurance companies. The government is considering limits on the insurers. One of the limits is to require that insurers cannot pick and choose the healthiest patient. Right now, they choose the healthiest people to insure so that they can maximize their profit, because the healthiest people don't get sick that often. Limits on drug companies. The government is reviewing all the previous preferences granted to the drug companies for them to make more money. In this case, we can reduce the drug costs for the public. Limits on lawsuits. There should also be a limit that the lawyer can sue for any medical mistakes, because if you don't have a limit, the lawyers tend to sue for sky-high compensation. If there's a limit, it injects some certainties into the healthcare operation. In that way, doctors don't have to be overprotective of themselves about lawsuits. Appeal to providers. Doctors, hospitals, and all the healthcare providers are reminded that their noble profession as healers, not as profit maximizers. Their job is to help and serve the people rather than maximize their profits. Another thing we have to do is public education. To educate the public, emphasize that everyone is responsible for his own health, self-responsibilities, that they should not abuse the healthcare system or overuse the healthcare system. Remember that all the ideas that I've talked about only serve one purpose, which is to reduce costs. When costs are reduced, things will become much easier.